Hi everyone, today I want to talk about the stages of autoimmunity. My name is Dr. Nicole and I am a naturopathic doctor, and this video is for anyone who has an autoimmune disease, or you tested positive for antibodies but you haven't been diagnosed with an autoimmune disease, or you think you have an autoimmune disease but you're not quite sure. Then this video is for you. Okay, so let's get started with the stages. Stage 1 is a silent autoimmunity. This is where you test positive for antibodies but you don't have any signs or symptoms for that particular disease. So we'll use, for example, Hashimoto's, where you test positive for TPO and or TG antibodies, but you don't have any signs or symptoms of hypothyroidism. You'd be in stage 1. And stage 1, I feel like, is a really common stage, and not a lot of people know that they're even in this stage. Stage 2 is when you test positive for antibodies, and you start having signs and symptoms and even some tissue damage. So in Hashimoto's, that would look like positive antibodies plus symptoms of hypothyroidism. So you could have weight gain, losing hair, you can be constipated or low energy and start feeling depressed. Those are all symptoms of hypothyroidism, and you would be in stage 2. And again, I feel like stage 2 is also really common, and not a lot of people associate the symptoms that they're having with an autoimmunity because these symptoms can be very general. Stage 3 is when you test positive for antibodies and you have significant signs and symptoms and significant tissue damage or destruction. And usually at this stage is when you get diagnosed with an autoimmune disease. So with Hashimoto's, that would look like positive antibodies, signs and symptoms, and at this stage you would most likely be prescribed thyroid hormones because enough of your thyroid has been damaged that it's no longer functioning properly. And so these stages are really important, and I want to talk about stage 1 and stage 2 real quick, because usually during this stage I hear from patients that they test positive for antibodies, but a lot of times their healthcare professionals will tell them, let's just wait and see, come back in a year, we'll test it then, but for now let's just watch it and we'll just wait and see what happens. That's crazy town. I don't understand that, because really what you're doing is you're waiting for enough of your tissue or gland or organ to get destroyed or damaged that you end up in stage 3, and then you get diagnosed with an autoimmune disease and then you start treatment. When really in stage 1 and 2, there's things that you can do, like figuring out what are the triggers that are causing this autoimmunity. So with autoimmune disease, it's a combination of your genes, and it's usually a combination of genes, plus environmental triggers and factors together that determine your susceptibility of these autoimmune diseases and what turns it on. So that's why some people can have Hashimoto's and other people don't, even within the same family. So it's really important in stage 1 and 2 to figure out what are these triggers, and then you can prevent hopefully going into stage 3 and getting a full-blown diagnosis. And if you're in stage 3, if you haven't figured out what your triggers are, then that's really important to figure out what is causing this autoimmunity, what is triggering your immune system. Because until you figure that out, you're still going to have flares, you're still going to get progressively worse. And with autoimmune disease, you will always get flares. That is just a given. But the goal is really to prevent flares as much as possible and to get into remission. And you really can't do that if you don't know what's causing the autoimmunity in the first place. So that's really important. And these are the conversations you need to have with your doctor. I am not your doctor, so I can't give you medical advice, but you really want to start looking at what are these triggers, looking at your history. Sometimes your medical history will give you an idea of what could have caused this, like an infection, something you ate, or something that you were exposed to, like chemicals or toxins or mold. That, talking with your doctor about that, plus any physical findings that they find, will give you a better overall picture of how to really help and manage your autoimmune disease. And autoimmune diseases are complicated and they're complex. So, you could be in stage 3 and be diagnosed with, say, Hashimoto's, but that's also been linked to other autoimmune diseases. And if you've already been diagnosed with one, it's highly likely that you have another autoimmune disease. So again, going back to Hashimoto's, that's linked to pernicious anemia, rheumatoid arthritis, lupus, celiac. So you could have antibodies for all those, and all of those could be triggered by multiple different triggers than what is affecting your Hashimoto's. So you can see how this can start getting really messy and complicated, and why it takes time and why it's important to have realistic expectations when it comes to your autoimmune disease, because you will have flares. You know, it is a journey trying to figure out what is triggering you in the first place, and also future events that could possibly trigger you as well too, and also modulating and managing your immune system. So that takes time. And with the stages as well too, you can stay in stage 1 and 2 forever and never leave, and that's awesome. And for some people, they can go from stage 1 to stage 3 in years or decades. And for some people, they can go from stage 1 to stage 3 really quick. That could take a year or a month or a week. So you can really see why it's important not to just wait and see and just kind of let everything slide. You want to figure out what these triggers are. It's super important. So definitely go back to your doctor and talk to them about this. I hope it was helpful. If you have any other questions or concern, you can always comment or DM me. I can't answer specific questions because, again, I'm not your doctor, but I'm happy to answer any general questions. If you know anyone who has an autoimmune disease, or they tested positive for antibodies and they just don't know what's going on, send in this video, please. And thank you for watching. I really appreciate it. Yeah, I think that's it. Thank you. Have a good day and take care. I'll talk to you soon.